here's my paper. No rating on anything. No notes. I'm going to start my assessment. Knock, knock, knock. Oh. Hi, my name is Brittany. I am a student nurse from SBSU. I'm just going to do your head to toe assessment on you to get a general baseline on you. I'm going to wash my hands. While I'm doing this, can I get your name and date of birth?
Zoe Brown, 12/19/2006.
And where are we at today?
Doctor's office.
Perfect. So you're A&O times 3. I am comfortable moving on with my assessment today. I'm just going to ask you a couple general questions. Are you taking any medications? That includes over-the-counter and vitamins.
No.
Perfect. Any allergies to medication?
No.
Wonderful. Any medical diagnosis or background that we should be aware of for you? Any family history, diabetes, hypertension, cardiac issues, stroke, anything like that? No? Okay. Tell me about your diet.
Pretty good.
Good? Eat lots of fruits and vegetables, whole grain products? Okay. Do you exercise at all? How many minutes would you say you exercise a week?
18 minutes every day.
Perfect. That's awesome. Keep that up. Did you play any sports in school?
Yeah.
What'd you play?
Softball and volleyball.
So kind of hard on your knees?
Yeah.
Any pain with them?
No.
Okay. Any pain with like your wrist from the volleyball? Okay. Good. Do you smoke? That includes vaping or any illicit drugs?
No.
Good. Do you drink alcohol at all?
No.
Okay. So now I'm going to start with grabbing a set of vitals on you. Blood pressure. One 12/64. Is that about normal for you? Yep. Okay. I am going to grab a temperature. Just going to point this at your forehead. 98.5. That's good. I'm going to put a pulse ox on you, but first I'm going to assess for any clubbing, and no clubbing is noted. While I'm here, I'm just going to do a quick capillary refill check. Less than 3 seconds on that one. Less than 3 seconds there, so I'm not worried about any perfusions issues. I'll put that on here, and while that's thinking about it, I'm just gonna grab a heart rate from you, and then count your respirations too. Okay, 14 for your respiration rate, 99 for your O2, and then I got 110 for your heart rate. So all your vitals are normal. Now I'm going to start with your head and just kind of work my way down, okay? I'm going to inspect your hair. Any head lice history that we should be aware of? Any dry skin or anything like that?
Nope.
This side. No lesions or abnormalities there. Any pain when I do this?
Nope.
Okay, no pain or tenderness is noted. I'm just going to feel your occipital lymph nodes. Any tenderness?
No.
Okay, and they are now palpable, so that's good. I'm just going to finish up my lymph nodes while I'm here. So I have your pre-auricle, any tenderness?
Nope.
Post-auricle, any tenderness?
Nope.
Okay. Your cervical chain, any tenderness?
Nope.
Your Mandibular, any tenderness?
Nope.
Submental, any tenderness?
Nope.
Okay, and if you could go like a bear. Okay, lymph nodes are non-palpable and no tenderness, so I'm not worried about any infection. Gonna just check for skin touching. No touching, so I'm not worried about dehydration there. I'm going to move on to your ears, just gonna palpate them, any tenderness with that.
Nope.
Gonna inspect them. No redness, draining, or earwax noted. Do you have some ear piercings? Any pain with that, or any issues with that?
Nope.
Okay. Going to palpate your frontal sinuses. Just let me know if you have any tenderness. Any?
Nope.
Okay. What about your maxillary? Any tenderness there? Good. That's the way it should be. So then we will move on to your eyes. I'm just going to pull your eyes down, you look up, and then vice versa. Okay, so they are pink, moist, and intact. No excessive drainage or tearing there, so we're good there. I'm going to just do a couple cranial nerve testing with your eyes. Okay, so you can just look at me if you want. Good. Good. I'm just going to reflect it off of your nose and into your eyes. Perfect. Now, follow my pen light with just your eyes without moving your head, okay? Okay, so eyes of Perla, that's good. Then go ahead, touch your nose, touch my pen, touch your nose, touch my pen, touch your nose, touch my pen. Perfect, and then look at my pen light, look at my hand, pen light, hand, pen light, hand. Perfect. So we just tested your cranial nerves 3, 4, and 6, which is your ocular motor, your trochlear, and then your abducens, and they all are intact there. I'm not worried about that. So now I'm going to move on to your nose. Go ahead and plug one side, breathe in, and then plug the other side, breathe in. Any issues with that? Okay. So close your eyes. I'm gonna have you smell something, and then you just tell me what it is if you're able to smell it. Okay?
Yep. Coffee.
Good. So I just tested your cranial nerve 1, your olfactory. That's good and intact. I'm just gonna look inside it. Your mucous membranes, they are pink, moist, intact, and no deviated septum there. I'm just gonna look at your lips. They're a little bit dry, probably just from the weather.
Yep.
It's about normal for you. Go ahead, open your mouth normally, keep your tongue in there. Okay. Everything is pink and moist. No lesions or cuts there. Everything's there. Stick your tongue out for me. Good. Move it side to side. Perfect. That's cranial nerve 11, your hypoglossal. That's intact. Now we are going to test your gag reflex. I'm not really going to gag you. I'm just going to have you stick your tongue out. I'll push down on it, and then you say ah, okay? Perfect. So you went up, soft palate moved. That was cranial nerve 10 and 9, which 9 is your glossopharyngeal and 10 is your vagus. Those are all intact, so I'm not worried about that, okay? So then we are going to test cranial nerve 7, which is your facial nerve. I'm going to have you close your eyes, and I'm going to touch your face in a couple of spots with a Q-tip, and you just tell me where you're feeling it at, okay?
Nose. Forehead. Cheek. Chin. Cheek.
Perfect. Can you smile? Can you frown? Can you puff your cheeks out? Perfect. Cranial nerve 7's intact. Go ahead and open your jaw. Shut your jaw. Clench it. That is cranial nerve 5, trigeminal. That's good there. I'm going to move on to your trachea. I'm just going to make sure it's midline and not deviated, which it's not, so that's good. I'm going to palpate your carotids one at a time. So I'm just going to feel here. Good. Good. I'm going to listen for bruits. Bruit is just like an obstruction in your blood flow, and we don't want that. No bruit noted there. No bruit there. That's good. So now I'm just going to move on to your shoulders. Can you shrug your shoulders for me? Perfect. That's cranial nerve 11, your spinal accessory. There. Now I'm going to test your range of motion in your shoulders. So what I'm going to have you do is do like a swimming motion forward. Got some cracking and there. Any pain with that?
No.
Okay. Can you do it backwards for me? Perfect. Any pain there?
No.
I'm going to inspect your arms. Skin color is even. Just got a couple moles and a tattoo. Any issues with your tattoo?
No.
Hands are good. Just gonna palpate any tenderness there.
No.
Okay. What about down here?
No.
Okay. I'm gonna do the same to this side. Just gonna look at it. Skin color is even and symmetrical. Any pain?
No.
Even down here?
Yep.
No pain?
No.
Okay, good. So that's good. I'm gonna test. Just feel for your brachial pulses. Okay. And then your radial pulses. Good. They are symmetrical. No issues there. Now I'm going to have you bend your elbows and then out, in, out, in, out. No creaking. Any pain?
No.
Okay. Can you move your wrists in a circle? Any pain when you do that?
No.
Perfect. Go ahead and squeeze my hands. Good. Put your hands out like that. I'm going to push down, you push up. Okay. Vice versa. I push up, you push down. Good. Put your hands like this. I'm going to push in, you push out. Good. And then opposite, I'm going to push out, you push in. Okay. And then I'm going to have you do an okay sign. And then we're going to go like that and then back as fast as you can. Perfect. And then go ahead and do there, and then we're going to flip them over, and then back and forth as fast as you can. Perfect. That's good there. Just going to look and make sure I got everything. I got everything, so we're going to move to your back now. Is it okay if I untie you?
Yeah.
So I'm noting that her spine is midline. There's no curvature noted. I'm just going to touch lightly. Any pain when I do this?
No.
Okay. Is it okay if I put my hands around your neck on each side? Okay. I'm just going to feel for the thyroid gland. Go ahead and swallow. And then swallow. Perfect. No nodules or enlargement was noted on there. Skin temperature is warm. Just got a couple moles. Any problems with those?
No.
Okay. So now I'm going to listen to your lungs in a couple different places. I am going to have to listen to a full breath in and full breath out, which is a little bit time consuming and can be tiresome. So just let me know if you need to take a break, okay?
Yep.
First, I'm going to establish a baseline. So go ahead, take a nice deep breath. Okay, do again. Perfect, right there. Okay, nice deep breath in. Again. Again. Last one for each side. One sounds are clean, are clear, no wheezings or crackles is noted, which is good. That's what we want. Now I'm just going to do some tapping along your back, okay?
Yep.
much in the same spot that I just listened to. That was residence. I'm going to leave you untied and you can go ahead and lie down. Alright, so now I'm going to look for jugular vein distension. So I'm just going to remove your pillow, okay? And then go ahead and look that way. No distension there. And then go ahead and look my way. No distensions noted there, and if that was there, I would be worried about fluid overload, and we raise the bed up to 30 degrees, see if it goes away, okay?
Yep.
Now I'm gonna listen to your heart. Is it okay if I pull your gown down? So for this section, I do have to listen to it in multiple areas, different ways too. Don't be alarmed, it's normal for everybody to do that, okay? So clavicle, space, rib, 1, space 1, rib 2, space 2, this is your aorta, S1, S2 noted. No murmurs, that's good. And we're going to do the same thing on this side, okay? Space. 1. Space 1. 2. Space 2. This is your pulmonic valve. S1 and S2 is noted. No murmurs noted. Rip 1, space 1, rip 2, space 2, rip 3, oops, sorry, space 3, this is Erb's point. S1 and S2 is noted. And no murmur. Space, rip 1, space 1, rip 2, space 2, rip 3, space 3, rip 4, space 4. This is tricuspid. S1 and S2 is noted. No murmur. So that was space 4. Space 5. Over here. Your clavicle, this is your apex. S1 and S2 noted. No buoy. Just gonna flip it back over and listen to it for a full 1 minute. It's your most accurate heart rate, okay? at 66 there. That's good. I'm gonna lift this back up, and then I'm gonna do an abdomen assessment on you. I'm gonna have you put your hands at your side for me. Is it okay if I lift your down up? Alright, so first I'm just gonna inspect it. Skin temperature is warm. There's just a few moles. Any changes with those? Okay. Now I'm gonna inspect it here. You can see your aorta pulsing, but no distension. And same thing down here. So that's good. I'm just gonna move these down a little bit, okay?
Yep.
I'm gonna listen to your bowel sounds. Can you see good here, Mom? Bowel sounds are active times 4. Now I'm going to listen to your arteries in your belly, okay? This is your aorta. Ovaries noted. Your renal. Ovaries noted. Other renal. Ovaries noted. Down to your iliac. Ovaries noted there. Other iliac. And ovaries were noted there. So that's good. Now I'm just going to tap in a few places just like what you did on your back, okay? Okay, so that was tympani, and then I'm gonna do it up to your liver. Dullness over your liver border. That's good. Now I'm going to do light palpation, so light pushing on your belly. You let me know if you have any pain or tenderness, okay? Any tenderness with that?
Nope.
Okay, so no tenderness is noted with the light palpation. Patient wasn't grimacing, so I'm going to move on to deep palpating. Any tenderness or pain? Okay, so that's good. No tenderness or pain noted. We are done there. I am going to just finish up with my arteries real quick. So I'm going to check your femoral arteries. Go ahead and put your legs out into like a frog position. And then other one is there. They are symmetrical. That's good. I'm just going to cover you up for just a second. I'm going to listen to them. No brewery noted in that one. No brewery noted in that one. That's good. Alright, so now we're going to move on to your legs. Go ahead and sit your legs out. Yep, just like that. I'm going to feel for your popliteal arteries. They are symmetrical. I'm going to remove your socks, okay? I'm going to feel for your posterior tibialis artery, and they are symmetrical, and your dorsal pedis artery, and they are symmetrical there. That's good. Go ahead and put your legs out for me. I'm going to do sharp and dull sensation on you. So this is sharp, and this is dull. Okay, so with your eyes closed, I'm gonna poke your legs and your feet in a couple of places. You just tell me if it's sharp, dull, and where do you feel it at, okay?
Sharp. Sharp. Dull. Bottom. Dull.
Perfect. Alright, so that's good there. I'm just gonna inspect her skin color, which is good. It is warm to the touch. Just have a couple bruises and some moles, no problems with that. Okay. Palpate for muscle tone and any tenderness when I do that? Okay. Any tenderness in this one?
No.
Okay. Muscle tone is symmetrical in each one. You can go ahead and sit up if you'd like. Now we're going to do some range of motion on your legs. Stay over here. Go ahead, kick them out. Any pain?
No.
Okay, no creakings noted. I'm going to push in, you push out. Okay, I'm going to push out, you push in. Perfect. I push down, you push up. Good. And I'm going to move on to your ankles. Can you move them in a circle? Good. I'm going to push them down, you push them up. I push them up, you push them down. Good. Now I'm going to check your reflexes, so I'm going to have you close your eyes. Okay, good. I got that one. I didn't get this one though. But that's normal for you, right?
Yep.
Okay. We're all set there. I'm going to put your socks and shoes on. Alright, and before you stand up, I'm just going to talk about that here so we're not exposed. Alright, you can go ahead and stand up. Any dizziness, lightheadedness?
No.
Okay. So I'm going to have you have your feet shorter length apart with hands off of the side just a little bit. Close your eyes. Okay. No swaying is noted, so you do have a negative or on text. You feel okay still?
Yep.
Okay. So we're going to have you walk a few steps forward. And then go ahead, turn around, and we're going to do heel to toe back to the bed. Okay, you can go ahead and have a seat. So given your medical information that I obtained from you, you have a healthy diet, you're mobile, you don't have any incontinence issues, I would give you a rating score of 23 out of 23. And that's the end of my assessment.